Imagine not being able to read the newspaper when you wake in the morning, or not being able to drive your car to work each day. Imagine not being able to watch your favourite sporting event. Well, there are a staggering 270 million people in the world who can't do these things. Simple pleasures that we just take for granted. They have what's called low vision. Low vision can be due to a whole range of eye diseases, or simply to a lack of spectacles. Now try to imagine a life led in blindness, not being able to work at all, not being able to see the faces of our friends or family, not being able to look out over a glorious scene. There are a further 45 million people around the world who are blind. 45 million. That's twice the population of Australia. And half of these blind are our neighbours. They live in Asia and the Western Pacific. 22 million people. We are surrounded by the same number of blind people as the population of this lucky country of ours. And in Asia alone, there are 1 million children who are blind. And these children receive little, if any, education. And their work opportunities are often limited to poorly paying jobs such as basket weaving, woodwork, or massage, if they're lucky. And in the developing world, adults who become blind often can't work at all. They can't provide for their families. They lose their self-esteem and independence. They become trapped in a life of poverty. They even die at a younger age. And what's really disturbing is that over 3/4 of this blindness is preventable or treatable. It's called avoidable blindness. It just shouldn't be. So, why is this? Well, there are many reasons. Firstly, 90% of the world's blind live in developing countries where health resources are scarce, particularly in the rural areas. And there is a lack of awareness amongst these populations as to the availability of services to correct their poor vision. But most profoundly, there are just not enough eye surgeons on the ground doing the work. Take Burma, for instance. There are just over 200 eye surgeons for 55 million people. In Australia, we have nearly 1,000 eye surgeons for half that number. So, what is the work that's needed? Well, a large part of it is removing these culprits, cataracts, a clouding of the lens inside the eye that slowly develops as we age. Cataracts form the vast majority of blindness in the developing world, yet it's a condition that's easily treatable by a safe, routine and low-cost operation, cataract surgery. With 1 million people newly blind from cataracts every year, the rate of operations to remove these cataracts is not keeping up with the rate of their formation. We're just not getting on top of this enormous problem. So, what is the solution? We believe that Sight for All has the answer. Sight for All is a non-denominational, not-for-profit organisation based at the South Australian Institute of Ophthalmology. The team at Sight for All is dedicated to fighting avoidable blindness in the world, and we achieve this through 3 sustainable mechanisms: research, education, and the support of infrastructure. Sight for All's voluntary teams are invited into our partner countries by the eye health leaders. We then work together in a collaborative and harmonious way with the local eye surgeons and their staff to come up with solutions for the unique problems that are identified in each individual country. This is what we like to think of as a shared vision. The aim of most blindness prevention organisations is to churn through the workload, to remove this enormous burden of cataract blindness. Sight for All is unique in that it uses research and collaborative discussion to identify the problems and provide solutions, and then implements the project activities through education and the support of infrastructure. It's a very powerful team. Now, let me give you a few examples of how each of our 3 activities are having a huge impact on blindness in our partner countries. Firstly, research. Adult blindness surveys are vital to determine the magnitude and causes of blindness in a country. We have done these in a number of countries. Let me give you an example. In Burma, in 2005, Sight for All ran one of the largest developing country blindness studies ever undertaken. And what did we find? We found the highest level of blindness ever reported. 8% of the adult population was blind. Nearly 1 in every 10 people were blind. Every day, myself and my colleagues examined over 100 adults for a month. And every day, almost every person we saw had some degree of visual impairment. It was absolutely staggering. we just don't see anywhere near that level of blindness back home. It made us all want to help. Why so many blind at such a young age? Well, nobody really knows. We have a number of theories, and we are planning research activities to try and get to the bottom of it, and we think we will very soon. In the meantime, we've presented this data to the Ministry of Health in Burma, and the government there has already started to train more eye doctors and open more eye centres around the country. That's exactly the impact that Sight for All is achieving through our research. Sight for All also carries out children's blindness studies. Let me give you another example. We undertook the first survey of all of the schools for the blind in Burma a couple of years ago. And what did we find this time? We found that the number one cause of blindness amongst children was measles. Measles. I'm sure you had no idea that measles can cause blindness. Well, it sure can. This boy is blind from measles. It's a disturbing image, isn't it? But most of the kids we saw in this study looked like him. My team members and myself were all quite shaken by the experience. Malnutrition, in particular vitamin A deficiency, turns measles into a blinding, deadly disease. It's a sign of a desperately poor country, a country without an adequate vitamin supplementation program, a country without an adequate measles vaccination campaign, a country in need of our support. So now you can see the importance of research in sustainable blindness prevention. Our second major activity is education. Surgical teaching in country is great for upskilling the local eye surgeons, and we do this in a number of countries on a regular basis. However, we have a much bigger impact by bringing eye surgeons to Adelaide for subspecialty fellowship training. We have now trained fellows from Burma, China, India, Nepal, Sri Lanka and Vietnam, and have plans for fellows from Cambodia and Laos. This is Dr. Tan Tun Ong from Burma. He has just completed his 12-month paediatric eye surgery fellowship at the Women's and Children's Hospital in Adelaide. Tan returned to Burma in early 2010. He is now the first and only paediatric eye surgeon in his country, the only one for 15 million kids. Can you imagine how busy he's going to be? But what a wonderful advocate for children's eye health, education and poverty alleviation in his country. And Tan will now train his own fellows so that Burma can reach the World Health Organization recommended target of 1 paediatric eye centre for every 10 million people in the country. Once again, that's exactly the impact that Sight for All is able to achieve. Sight for All also conducts health promotion seminars to educate healthcare workers and nurses, to spread the word and raise awareness at the village level of the availability of local services to help blind children and adults. So now you can see the importance of education in sustainable blindness prevention. Our third major activity is infrastructure support. There's no point in offering research and education if the eye surgeons and their staff don't have the tools of the trade. So we help establish new eye centres and clinics, or upgrade the facility at existing eye centres in our partner countries, both the major teaching hospitals and the rural centres. With the support of the Australian Government, we have opened 2 new rural eye centres in the cyclone-ravaged Delta region of Burma, and we are currently upgrading over 30 centres around the country so that the eye surgeons at these centres can work at their maximum level and with the best equipment to tackle the blinding eye problems they come across, particularly cataracts. Sight for All is looking at the big picture, but how much does it all cost? Well, it costs about 2 cents to provide vitamin A to a child to prevent malnutrition and its blinding and deadly consequences. It costs less than $1 to prevent measles in a child. And it costs roughly $30 to remove a cataract, even a child's cataract. But to remove a child's cataract, you need specialised training. It's not that easy. By providing fellowship training to eye surgeons from Asia, Sight for All is transferring these subspecialty skills to the local eye surgeons to be used on a daily, ongoing basis back home, and thereby benefiting the entire country. It costs $40,000 to train a fellow such as Tan in Australia. And now that Tan is finished, we have a paediatric fellow from Sri Lanka who has just taken his place. And when he returns home in a year, he'll be only the 2nd paediatric eye surgeon in his country, the 2nd for 6 million kids. And we will continue to train fellows in Australia from all over Asia, and then set each of them up in a specialised clinic back home so that preventable and treatable eye problems in adults and children can be addressed on a broad, sustainable level. It costs roughly $60,000 to equip a paediatric clinic in Asia. So for roughly $100,000, we can ensure the well-being of 15 million children in Burma and now 6 million children in Sri Lanka. It's a small price to pay. Just to recap, there are nearly 300 million people with low vision and a further 45 million people blind in the world, and half of these live on our doorstep. And Sight for All is not forgetting our responsibilities back home. Trachoma is a blinding yet preventable fly-borne infection that begins in childhood and is still an endemic problem in the outback communities of Australia, one of the few places in the world. And diabetes is ravaging the eyesight of the adult Aboriginal population. So, Sight for All is working together with the Aboriginal Health Council of South Australia in the planning of eye disease awareness and prevention campaigns for the local communities. We also feel very passionate about the possibilities here. It has been estimated that if we can halve the level of blindness by the year 2020, there will be a gain of $100 billion to the impoverished communities of the world. It may just be the kickstart that's needed. So, Sight for All is not just helping the individual. We're helping the family, the village, the entire country. However, I believe we all have a responsibility to tackle this immense problem, not just the eye surgeons. We can all play a part so that blind children and adults in less privileged areas of the world can perhaps once again have the opportunity for an education, to work and contribute to their society, or see the faces of their loved ones. Imagine again a life led in blindness. Now, imagine being able to help these blind people lift that veil of blindness. What a wonderful feeling. What an extraordinary opportunity. Please get behind Sight for All and help us to lift this veil of blindness hanging over the world. Thank you.